everybody. Hello, and happy Tuesday to you all. Welcome to my YouTube channel. I'm Dr. Carmen Bryant, and this is Redefining Yourself. We're talking about overcoming narcissist abuse. And so to all of you that are new subscribers, thank you so much for joining me and finding something valuable that I have to say that may help you in your situation or the aftermath of your situation. And those of you that have joined me live, thank you so much for joining me. Thank you so much for interacting with me. If you have not already, please subscribe to my YouTube channel. It is Dr. Carmen Bryant, Overcoming Narcissist Abuse. Hit the subscribe button and hit the bell so you know whenever I post videos. I post Tuesday through Friday, pre-recorded videos, and then I come on live on Sundays where I'm open. You can ask me whatever questions you'd like to ask. Please allow me to add a disclaimer. I am a licensed mental health counselor in the state of Washington. I cannot provide counseling outside of the state of Washington. I cannot come on live and do assessments. I cannot do diagnosis. I cannot do those types ethically. I cannot do those type of things. I am a coach. I am a life coach. And if you are interested in coaching, you're welcome to email me at Dr. Carmen Bryant, DrCarmen Bryant at outlook.com. I will send you more information. I do have a high caseload, and so I do not want anyone to feel like you're being left out. There are thousands of people that reach out all the time and email and call, and so I have a wait list as well, and so I cannot reach out and talk to everyone. And so I hope that the time that I spend with you on YouTube will help you as much as possible. And you know, I don't want to sound or look insensitive to anyone, but I cannot reach out to everyone. And then there are some things that are disclosed on Facebook and YouTube. I tell you guys, be very careful with the information that you disclose. There are some things that as a professional I recognize are not coaching issues, but those are therapy issues. And those are things that if you go to Psychology Today, you can look up counselors in your area that specialize in different things. I cannot provide you with counseling, nor will I contact you to talk about counseling things. In coaching is totally different than counseling. I do not do diagnosis, and here in my office I do diagnosis, assessment, treatment plannings. I also do referrals, and I also do I connect with med providers and I provide them with the assessment results when I do the testing and measurements. However, when I do coaching, I provide coaching, meaning I coach you from one place to another. I do not provide counseling, so there is a difference. So I cannot provide that on YouTube, nor can I do that live. And so I know there have been questions, and I just wanted to put that disclaimer out there that I cannot do that ethically and professionally. I cannot do that and provide that. That's why I do the videos, which is called psychoeducation. It's providing you with psychological education on the situation that you are currently in or have left, or what you may be going through behaviorally or psychologically after the aftermath of being in a relationship with a narcissist. And so thank you guys so much for trusting me with that. I also have a Facebook page, which is Psychological Health Consultants and Services. You can hit the thumbs up, and I post videos on both. And so today I just wanted to talk about narcissism, borderline personality, and some of those after effects of coming out of relationship. You know, I had a question that came across: what is the difference between bipolar personality disorder and what is the difference between narcissistic personality disorder? Both have very similar traits, and both of them do stem from traumatic childhood. I do know that some of you have asked, have all narcissists been sexually abused? Not all narcissists have been sexually abused, but they have been emotionally, they have been abused in one way or another, either emotionally, physically, or sexually. The ones that I have diagnosed in my office throughout the years that I've been here, and I am a trauma professional, the ones that I have diagnosed, all of those had a history of sexual abuse, rejection, abandonment issue, and physical abuse. A lot of them pretty severe. And so a lot of them did have not only post-traumatic stress disorder, but also narcissistic personality disorder. And so in not all people that have been traumatized in childhood do develop narcissistic personality disorder. Some of them do develop borderline personality disorder, or other ones. We're talking about borderline today. Sorry, you guys. But not all of them develop NPD. Some of them develop BPD. And with BPD, which is borderline personality disorder, do know that borderline personality disorder and bipolar disorder look very similar, and sometimes they are misdiagnosed. People sometimes are being diagnosed with bipolar disorder, and they're giving the medications for bipolar disorder, when in actuality some of them have borderline personality disorder. With borderline personality disorder, the emotions are severely unregulated, very similar to the bipolar. However, with bipolar disorder, when we diagnose bipolar disorder, the mania or the manic episodes usually last between 3 to 4 days, and then after that, and it may not happen every month. It may happen every few months, every other month. And there's bipolar 1 and bipolar 2. And then they drop down, they level back down, they go into major depressive disorder, which may last 2, maybe 3 weeks. And so they're very distinctive when it comes to the diagnosis, when we're diagnosing, very distinctive features and timelines. With borderline personality disorder, the mood happens and is unregulated, and it can happen hours, moments, or days, and it goes up and down, up and down. Seems like they're manic, all of a sudden they drop down to depression. And a lot of the people with borderline personality also self-sabotage. They sabotage. And so here I got onto sitecentral.com, where it talks about complex trauma and borderline personality disorder. So I'm just going to read a few things off of here. And so as you know, as a trauma professional, I do know, and I just got through with some training on trauma training. One of the biggest things, those people that have trauma or have post-traumatic stress, a lot of times within the diagnosis, when I've diagnosed someone with post-traumatic stress disorder, and that's the one that's in the DSM, post-traumatic stress disorder. Complex post-traumatic stress disorder is not actually in the DSM, but I'm quite sure it'll probably show up in the DSM eventually, because complex post-traumatic stress is when you have been traumatized on a consistent basis, constantly. Post-traumatic stress disorder is an event or events that has happened, and now you have the after effects and the symptomology that goes with after the trauma. Usually it happens within, I think it's a month. I think the criteria is a month after the event, and then there are some that may have delayed onset, a month or 6 months after the event. And they've been triggered, they may have been triggered. But usually, I think it's acute stress disorder, which is usually what happens after a traumatic situation, a car accident, something happened where you're experiencing the symptoms. It's like post-traumatic stress symptoms, but it's acute stress disorder. I think that's the name of it. And that's usually within like 2, 3, 4 weeks period of time. And then it dissipates. And then you go back into the normal living. You learn to regulate, you kind of regulate, and then you go back, your stress levels are back down. With post-traumatic stress, after a month time, the criteria is usually about a month time period, those symptoms either get worse and they have more, and you meet that criteria, but that's from the trauma. And so as a therapist, one thing that we do know is that when you are treating clients with trauma, and some of you coming out of a narcissistic relationship, whether it's with your parents or is with the what we call the loved one, or we call the loved one the intimate partner or the partner, a lot of you are coming out with post-traumatic stress or complex post-traumatic stress. We know that a lot of times with post-traumatic stress, there's other trauma related diagnoses that go along with that. And some of that, and we know, especially if you had childhood trauma, is borderline personality disorder. That's why usually dealing with what type of trauma you've been through, and there are researchers that say that bipolar disorder, you'll find 90%, a lot of times they found not up to 90% of the clients have had childhood sexual trauma, and especially childhood neglect, childhood attachment problems, or rejection issues. And if you notice, people with borderline personality disorder struggle with attachments. They attach really quick. They're very passionate when they attach, and if you tell them no, or if you don't do something that they want them to do, you notice that they're very emotional and they sabotage, and then they hate you, and then they love you and hate you, then love you and hate you. You leave me and leave me alone, but don't go too far, don't go away, don't leave me. And so that's kind of the mentality of people with borderline personalities. Here it says that some therapists won't work with people that have borderline traits because of the symptoms can be high maintenance for a therapist to deal with, especially if they aren't prepared. I myself do not work with personality disorders, even though I know when I have people that come in that have post-traumatic stress and are traumatized, I do work with traumatized clients. That is a lot of my caseload, traumatized clients. However, if the personality disorder is more intense than, so in other words, if I'm dealing with trauma and they have other issues that go along with that, PTSD, all that kind of stuff. However, if the personality disorder outweighs the PTSD or the trauma symptomology and is very, very intense, or they become very self-sabotaging, or if they become sabotaging of themselves, a lot of them, in order to, when you tell them no, or they may want they may want you to see them on a daily basis, and you tell them that's not how therapy works. We will see each other on one day per week, once a week. They may threaten suicide. They may call and say, I'm gonna die, or I'm gonna do this, and so they will emotionally manipulate you to get you to do what they want you to do. Other things like you're the best therapist in the world and no one understands me like you do. If you leave me, I'm gonna die because you're the first one that's ever helped me. And then the next minute when you tell them, no, your appointment is next week at this particular time, then they hate you and I don't need to come to you anymore. I'm cured. There's nothing wrong with me. There was something wrong with you, but they self-sabotage a lot. When you say no, they'll manipulate. They're very dramatic. A lot of times they're very, very dramatic. They want attention. They need attention. Somewhere in their childhood they had a problem. A lot of times in the attachment disorders, attachment problems with the caretaker, where they have this need to be loved. They have this need to connect, and their perception with boundaries, their perception of boundaries is that you don't care about them. They will even sabotage perfectly good relationships. They jump into relationships entirely too quick. And I'm going to differentiate between narcissism and bipolar in just a second. So I do not work with the majority of personality. I do not work with NPD. I usually refer them out, and I deal with the victims or the survivors of NPD, but I usually do not work with NPD. With other personality disorders, if borderline tends to be more severe and complicated in counseling, I usually refer them out as well. And most therapists you'll find really don't like working with clients that have severe personality disorders. I have a colleague that loves working with those that have personality disorders, and I usually refer them to her, and she enjoys working with them. And it's not that I don't enjoy, it's just very high maintenance, and it's very manipulative. And you spend a lot of times calling the police to do health and welfare checks in their homes. They're very lonely, and I can't do it without you. And if it's not, if you don't do it, it's not going to happen. So a lot of times they also learn to manipulate to get, they learn to manipulate to get their needs met. And so they'll do anything, even on a public forum. A lot of you read some of the posts, and with that information, some of you can pick out those people that tend to look like they have the symptomology of bipolar disorder. So you guys be careful, because a lot of you are empaths, and so you will feed into that, and they'll make you feel like you don't care if you don't feed into that. So you have to be very careful how you handle that, because they will become very dramatic. They try to force you into talking to them, or force you into connecting, or even with the therapist, they force you into, you tell them you're going to refer them out. They even to a point where they will look for your address or find out where you stay. They want to be your best friend. They want to be your friend. Why won't you be my friend? We can be friends, so they don't have it. When you say no, it's like they never heard you. You tell them you can't do that, it's like they never heard you. They don't care. They're focused on themselves. Let's see. So I think I got that out the way. So let's go to the next one. Still on Site Central, and this one is what causes borderline personality disorder. And so here, and this is after trauma, what causes, and this is by the last one, let me make sure I give the proper credit, is Sarah Staggs. She's a licensed clinical social worker and a mental health MPH. Excuse me, you guys. Okay. And this next one is What Causes Borderline Personality Disorder, also by Sarah Staggs. And I'm just going to scroll down to something really quick to give you an idea. So when you take what she said is when taken as a whole, the symptoms describe a person who struggles with managing emotions in the relationships. To someone experienced attachment trauma, other people can be either idealized or vilified. So you're either a villain or you're the greatest thing since sliced bread. Much time and attention is spent avoiding abandonment. So with borderline personality disorder, a lot of their time is to avoid perceived or real abandonment. And think about it, they are so emotionally charged that they will literally suck the energy out of you to a point where a lot of people don't want to deal with them. They need a lot of reassurance. They need a lot of answers. They will hunt you down. They will email you. They text you, and so most of their relationships are intense and very short-lived. Let's see. They have this feeling of chronic emptiness, perhaps a lack of self-identity or self-concept. They can be very impulsive, and most of them are very impulsive, quick to anger, dissociate, and do self-harm. So a lot of them do self-harm, and a lot of them, and I'm not saying that they're not suicidal. So anytime a person is doing self-harm, they're telling a story. They're telling you a story about their pain. Their pain is being shown in the self-harm injuries, also, with that self-harm, it serves a purpose of releasing tension, and a lot of times they also do it to get your attention. And they'll do that because they know that you have to report, you have to check on them. So if whatever they have to do to get your attention, once you connect with a person with borderline personality disorder, they will do whatever they can to maintain your attention. And they do have a history of suicide attempts. And so that's why you have to take it serious. Those of you that are in the field of the helping field, clinical field, even if you think that they're trying to get your attention, you still call. You don't have to go to their house. Some of them want you to come to their house. Some of them want you to talk to them. You can call the police and ask them to do a health and welfare check, and make sure you annotate and keep good records. Let's see. So people with borderline personality usually follow the red line for, okay, this is a drawing they have on here, sadness, love, despair, etc. So they're extra sensitive, and let's see, they're extra sensitive. So let's look. Here, Ms. Sarah states that there's a lady by the name of Marcia Lynham, and the etiology of borderline personality disorder is both biological and environmental, and either one can be more important depending on the person. So the idea that these people experience attachment trauma when they're very young, remember I said that? A lot of them may have experienced attachment issues when they were very young. And I said this in another video, the main thing for an infant is connection. To connect with caregivers, they need some type of connection and attachment. And so she says, when we're infants and toddlers, we learn how the world will respond to us. If our world or caregivers' response is inconsistent or cold or highly anxious manner, then we don't learn to care for ourselves, and we often internalize that we deserve to be treated badly because there's something wrong with us. And so you hear them say that, what's wrong with me? There's something wrong with me. That's why people don't want to attach with me. That's why people always leave me. That's why people won't call me. That's why people, think about it. If a person is constantly doing that, people won't talk to me. Is there something wrong with me? Please talk to me. Please call me. Please, don't leave me. I know there's something wrong with me. They need the reassurance from you. And so it doesn't matter how much you reassure them. What happen is they'll drain you. It's like they suck you dry. And so let's see, let's make sure. So, so she said that this illness, the borderline personality, or something that causes an absent, okay, let's see. A lot of the children may have, or babies may have, experienced rejection or abandonment. And let's see. So, okay, let's make sure I give you all that. Let me see the next one. And so here, this one is borderlinepersonality.com, co-occurring disorders. And this is under elements behavioral health. and the title is BPD. And here I just wanted to grab something really quick, as we know that trauma can be caused by family violence, such as emotional or physical abuse, diseases, and even experience of war. Personality disorders such as borderline, avoidant, paranoid, antisocial, schizotypical may also be outcomes of trauma. So see, all trauma does not lead to narcissistic personality disorder. Because of the severe consequences of childhood trauma, it is also sometimes called soul murder. So let's see. Parental rejection or verbal assaults, devaluation, become ignored, all impact a child's identity. And so a lot of children that come out of homes that have parents that have narcissistic personality disorders are affected differently. Some of them do develop NPD, some of them do develop borderline personality disorder. If you're coming out of a family that has parents that are narcissists, a parent or parents that have had narcissists, those narcissists are very emotionally abusive. A lot of them may be physically abusive. Some of them are also sexually abusive. And so different people develop different types of disorders. And some people do come out of there not with NPD, they come out with borderline personality disorder. And they have this really big problem with attachment. Let's see. Attachment avoidance and attachment anxiety both may be a result of childhood maltreatment. Fear attachment styles are characterized by desire for intimacy combined with a fear of hurt and rejection, borderline. Let's see. Someone with unresolved or preoccupied attachment style may want an intimate relationship but has a tendency to view their partner as dependent. Let's see. Studies have demonstrated that people diagnosed with BPD have a high prevalence of childhood sexual abuse. In addition, childhood sexual abuse is associated with attachment avoidance. And so let's see. So an estimate of 75% rate of childhood sexual abuse in BPD patients. Furthermore, childhood sexual abuse was found to distinguish BPD patients from depressed non-BPD adolescents. Okay, so now let's go to the big question. Let's look at the difference between borderline personality disorder and narcissism. And so this is under, you can go to thediffer.com, the difference between borderline and narcissistic personality disorder. And this was written by, let's look at here. It did not say who this is written by. So let's look at some of the, okay. So first of all, let's look at the symptoms of BPD. I'm gonna give you some of the symptoms, and I'm gonna give you the symptoms of NPD, okay? So the borderline personality disorder, shifting sense of identity, spurts of impulsive behavior, frequent uncomfortable anger, self-harming behavior, extremities in personal relationship, and idealization of a partner is easily swapped for a devaluation of that person, that same person. So they'll idolize you and then turn right around and devalue you. So isn't that similar to narcissism? So constant feeling of emptiness inside and inability to remain alone for long periods of time. So that's BPD. So NPD, and these are just short, brief descriptions and not detailed descriptions. And so narcissist, NPD, you'll find fantasies of high success, absolute power, perfect romance, need for admiration and recognition, arrogant behavior, attitude toward people, unreasonable jealousy of others' success and achievements, exploitative tendencies, and exaggerated feelings of self-importance. So now let's compare the two and see the difference between the two, okay? And so this is the comparison chart. Let me look. Let me see if this is too long. Okay. So on the borderline, the BPD, people with borderline person or BPD view themselves as fundamentally bad and worthless. And NPD, they view themselves as perfect. You have the problem. BPD, borderline personality, is characterized by fear of being alone, while NPD feel perfectly well being alone. BPD tend to cling to other people. They're very, 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 very clingy, and they will emotionally suck you dry. NPDs could care less about other people. People with BPD are prone to self-damaging behavior and suicide. NPD would rarely damage themselves or commit suicide. So that's not really a common thing that NPDs will do. BPD is more common among women. NPD is more common among men. And remember, in the DSM-5, it says 50 to 75% of people in a clinical setting that was diagnosed with NPD were men. BPD have spurts of empathy, so they do have empathy. People with NPD lack empathy. They don't have empathy or the ability to attach to people. They lack compassion. BPD need attention to be saved. So they always need to be saved. They're very dramatic a lot of times. They need attention. They need someone to pay attention. NPD need attention to confirm their self-image. And so now here goes another comparison. So BPD persons tend to have a very low self-esteem. They see themselves as bad or worthless. NPD people, on the other hand, see themselves as kings or queens of the world. An individual with BPD often is scared to be left alone, and a borderline is clingy and always needs company. They have to be with someone all the time. And a narcissist, on the other hand, feels perfectly well when left alone. However, they need people for the purpose of fuel. That's why they attach to people. They have to have fuel. BPD has to have people to make them feel good. They're clingy. They need company. They need to be affirmed. They need to be told, that you're going to be okay and it's all right and I love you. And NPD, they don't really care. It's all about what they can get from you. BPD stick to members of the family, friends, or partners. They may sacrifice their time in order to care for those close because they think they will receive care in return. So what they do things because they need to be cared for. NPD do not care about people. What they do care about is their own self-image, and they often project a take it or leave it attitude. However, they need fuel to function. So I'm going to add that in there. They need fuel to function. So they need people in order to function. They need that fuel. They need something from people. That's why they move from person to person. Suicide and suicide attempts are frequent among people with BPD. Other self-harming and self-abusive behavior is also a sign of borderline syndrome. But people with NPD wouldn't harm themselves because their body and their health are necessary prerequisites of their overall successful personality, their beautiful self. Statistics show that women are prone to borderline BPD more often than men. Remember, I said that. And narcissistic tendencies, on the other hand, are found among men as opposed to women. For people with BPD disorder, sympathy is organic. They always feel people around, and the feelings are so excessive. They're excessive. So people with NPD do not care about others. They do not have any empathy whatsoever. The symptom is characteristic of psychopathic behavior, and psychopaths share a lot of traits with the narcissist, unless the narcissist does have psychopath or antisocial personality disorder as well. Those are called the malignant narcissists. Those were the malignants, the ones that have the additional diagnosis of antisocial personality disorder or psychopath, sociopath. The two types of disorders are characterized by totally different attention-associated traits. For BPD, constant attention is needed to ensure the safety of the suffering person. That person is always suffering. The NPD people, on the other hand, are fed by attention. It's though attention for them is the sort of fuel for their self-image. It is fuel for their self-image, okay? And so that is the difference between a NPD and a bipolar disorder. And so a lot of you that are coming out may also, though, when you're coming out of the situation, you have to remember that a person that has been in an abusive relationship for many years or has been very intensified, you had to adapt how you got your needs met. And so the way that you adapted, some of your adaptation is maladapted. You had to adapt in order to get your needs met. And the way that you adapted is you learned how to be manipulative. It's not that you were purposely trying to do it to hurt people, but in order to get your needs met, you learned how to manipulate people to get your needs met. You came out of the relationship, and when you came out of the relationship, and that's what I'm going to talk about either tomorrow, I'm going to talk about the residuals, the residual effects of coming out of a narcissistic relationship and what you're experiencing afterward, how your mind is thinking. You actually, for many people, have received brain damage from the trauma. Brain damage, not like a concussion, but brain damage to I know you guys are going to laugh at me. I'll tear a word up. The amygdala. but there's damage to the amygdala, one or the other. I'm gonna figure it out tomorrow. But there is damage to that portion of the brain from trauma, which can cause, confusion and brain fog. But we're gonna talk about that tomorrow. But with borderline and NPD, a lot of you come out, and some people, prior to even getting into a relationship with a narcissist, have been in families that were narcissists. And so you were being traumatized then. A lot of them already pre-exposed you. They had already groomed you and prepared you for more traumatic relationships because of the fact that you never had a real relationship, a healthy relationship. So you have nothing to gauge it on. And a lot of you left those families with borderline personality disorder or post-traumatic stress or complex post-traumatic stress from your family of origin or whoever your caretakers were. So it's almost like they just handed you over to a narcissist, and it was easy to get wrapped up in it, especially if you're experiencing borderline personality disorder. Meaning it was easy because they love bomb you, and that is what you so desired. And so that's how you got caught up as a borderline. But borderline personality disorder, they have this love-hate relationship. They will literally self-sabotage because in their minds is like, I'll sabotage before you sabotage. I'll leave you before you leave me. I'll break up before you break up with me. You have those that have been through college, in the last class right before graduation, they sabotage and then they don't graduate. Or they're in a relationship, things are going good, and then all of a sudden they sabotage because they never see themselves worthy of having a good relationship with anybody. If anything is going too well, it's like they just self-sabotage. And so that is the difference between a narcissistic personality disorder, and borderline personality disorder. I know I had someone ask me. So that is the difference between the two. Hopefully this has helped you. Hopefully it made sense. Leave some comments at the end. Thank you so much for tuning in. Thank you so much. If you have not already, please subscribe to my YouTube channel. Hit the bell so you see whenever I upload new videos, and make sure you stay tuned on Sundays. I come on between 8 and 9 o'clock live, and that is Pacific Standard Time, which is West Coast, and you guys are welcome to join me and ask whatever question you'd like to ask. Thank you so much, and you can also join my Facebook page, which is Psychological Health Consultants and Services. Hit the thumbs up, and I will post on both of them. I will upload the videos. Thank you guys as always. I know it was a little long, but I wanted to make sure I give good information out there to you, and hopefully that answered your question. Please leave your comments. Thank you so much. If you're interested in coaching, please email me, Dr. Carmen Bryant, drcarmenbryant@outlook.com, and I will send you details of the packages that I offer for coaching. Coaching, not counseling. Thank you so much. And as my friend always says, go and be great.